Normally, I would think that a bond would be more beneficial in the area of services versus area of product. I mean, to me, if you're going to give $100,000 worth of product, you're either going to give it to, you're either going to deliver it or you're not. $100,000 worth of services is a different situation. That is a situation where you may need to be bonded. But I mean, that's, Mr. Stanfield, with your association, what's the average sale of merchandise to an entity?
Well, it's an interesting anomaly because of the figures I gave you. I think it was about 103,000 of the total supplier numbers out there billed Medicare less than 300,000 a year. When you look at those raw numbers, many of those provide even smaller, more than 50% of those supply Medicare probably less than 15 or 20,000 a year because they're pharmacy-based suppliers.
So basically what you're saying is the accreditation of the individual or the company that's providing these services and are selling this equipment is much more important versus the bond.
Much more important.
Absolutely.
Much more.
Well, we got a lot of nods on that one.
Just took a while to get there.
Oh, well, this is Washington. It takes a long time to get anywhere around here. Mr. Stanfield, also, I asked the same question to Ms. Blackburn a minute ago. Do you have any information with regards to the overall increase that you would see in the cost of delivering your goods and services?
Again, it's very clear.
It's in there?
It's very clear from the Robert Morris University study, Dr. O'Rourke and Dr. Foreman prepared this, and I do have a copy here that you're welcome to take today if
Would you be willing to put that into the record as part of your statement?
I believe it already is. John, is that not a part of the record from last year?
If you could do it,
I think
this
it was from last year, but we can submit it again.
From May, I believe it was, Mr. Chairman.
Okay, thank you, appreciate that.
And also, there was another study, an independent study by Dr. Katzman that you have from the May hearing.
Okay. Mr. Griffin, during the course of your comments, something came up to me, and if we have scheduled rates, is there anything that could be done to, if somebody wanted to negotiate a different rate? In other words, if you're going to sell a piece of equipment or you're going to sell the services at a certain, and it's going to be scheduled by CMS versus bidded, if we went to a schedule, for instance, I'm going hypothetically here, is there anything could you not negotiate with someone a different rate on that, or is that once the schedule's set, it's set?
Let me answer your question and
Educate
then probably ask you a question, please, sir. Some years ago, when I was president of our state association, I worked with the state of North Carolina and our Department of Facility Services, DFS, with Health and Human Services, and we actually went down the fee schedule for Medicaid because the management of Medicaid, of North Carolina Medicaid, wanted to move towards competitive bidding. The DME providers, including myself and people with Health and Human Services, got together and we went through the entire Medicaid fee schedule, item by item by item. There was give and there was take from industry and from Medicaid on each individual item to decide what was appropriate. Medicaid knew what we were paying for items. They also looked at and respected the cost that we had for delivering certain items. At that time, when we went through that Medicaid fee schedule in the state of North Carolina, they came back to us to say that there would be a $10 million savings just on that one exercise. I've talked to a member of the PAOC, as Ms. Blackburn mentioned a few minutes ago, and we could very easily do that with Medicare. We could sit down with industry insiders. We could sit down with CMS. We could review the entire fee schedule. We'd have to do it in product categories. It'd have to be very methodical, very analytical. We can do this. And there would be some give and take.
Would you suggest this be done on a state-by-state basis or at the federal level?
Possibly regional. We've got the 4 MACs. We've got the 4 CMS MACs.
Okay.
It could potentially be done regional.
Okay, very good. Mr. Sloan, you made a comment, or I think somewhere I was reading here that 80% of the suppliers are small business folks. Is that pretty much correct?
That wasn't my comment, but
I think it's
90, was it about 90%?
90%?
90%.
I think it's
in
90.
excess of 90%.
Yeah.
Okay, and this, the competitive bidding portion of this says we only have to have a minimum of 30% be small business owners. In other words, we're protecting 10% and exposing getting rid of 60% of the people, just, or at least not allowing 60% of the small business people to bid here. Is that where we're headed with this?
Well, I
You see those
believe that
numbers?
they say a minimum of 30%. I don't think it has to be 30%, then they cut off the small providers. But yes, 30% is the maximum.
And what I'm trying to get to, though, is, in other words, if we would have something in there that says 90%, if 90% of the group or 80% or 75% of the group needs to be small business owners versus there's only 10% are large producers or large suppliers, I mean, we've got this kind of out of balance, do we not?
Oh, I believe so, yes.
Okay. Well, I'm just curious because you're part of the research here, I assume, that the study that will show us what kind of impact it would
I'm
have?
familiar with it, although I
Okay.
was not involved with it.
Okay, very good. And you made a comment about provider numbers need to be more, that CMS need to be more scrupulous on how they provide provider numbers so there's less fraud. Is that a problem right now? That we need to be
believe it's
concerned
a-
about and need to look into?
I believe it's an ongoing problem.
They're
It's
not,
still
they're not,
occurring.
they're not screening these correctly or allowing them, they're not accrediting the people correctly or?
I believe we're not making site visits. CMS is required to make sure there's an operation in business that's applying for a Medicare provider number. These are not taking place currently. I heard stories that through competitive bidding it did not take place. So how can we trust them to maintain the integrity of the program, any program for that matter, if we're not investigating the people who are applying for the provider numbers?
Right.
Accreditation is, which is part of the solution, I believe, is a first part of that.
Mr. Lewis-Meyer, I think Ms. Blackman can tell you that our National Association has put together a list, I believe, of 13
Yes.
different qualities, aside from licensure, aside from accreditation, that would insist that the provider and that CMS do certain things to continue to work with and provide Medicare services.
Fantastic.
Mr.
Yes.
Dr. Meyer, if I might make a comment as well regarding the site inspections. It's an interesting process. CMS contracts with the National Supply Clearinghouse, which is an independent company. They subcontract with another company to oversee certain aspects of compliance. And they subcontract with someone else who subcontracts with individual people to do the inspection on the sites. The site inspector that came to my company was a boiler inspector. He had never been to a DME company in his life.
Was it what kind of
He
inspector?
was a boiler inspector. We've had elevator inspectors, boiler inspectors, building site safety inspectors, auditors of this type that come to our companies.
He's an expert in medical
He was an
equipment.
expert. He came into the building and said, "I see medical equipment," and checked that off. And that was sort of the process that went through. And that's been repeated numerous times across the country.
Thank you.
Mr.
Yes.
Lukemeyer, if I could add one thing, it is that the NSC, who is contracted by CMS, the National Supplier Clearinghouse, is the entity that has the charge to make sure that any provider number that is given to a provider is legitimate. There is inventory, there's a store there is the ability to service a client. And much of what you read, what we all read in the national newspapers, the Wall Street, the New York Times, if you do your homework and you go back, you see that company should not have had a number in the beginning. It was not a company, it was a front. And so we consistently go back to, how did they get the provider number? This is hurting our industry, and we have to make CMS accountable for the oversight that they are to be giving this contract.
I'm finished. I want to thank each of you personally for coming today, and I want to, work with the chairman here. We've got some ideas on things that we want to do, and certainly look forward to working with each of you again. Be more than willing to have you contact my office to be able to give us further information or any kind of questions you may have about it.